Hi everyone, I'm going to talk about a recent video by Stephen Woodford, aka Rationality Rules. Even though he doesn't say anything I haven't already covered in previous videos, I think they're worth repeating. The video is called Elon Musk Declares War on Empathy, and it's Stephen reacting to a short segment towards the very end of this video, showing a nearly 2-hour conversation between Elon Musk and Jordan Peterson, in which they talk about the medical interventions that are part of so-called gender-affirming care of young people. I want to start by showing a couple of things Stephen says very early in his video.
First, note that they're talking about children receiving gender-affirming care.
Stephen gets very hung up on age of majority. By children, he appears to mean under 18, as if once you're 18, you're an adult in every sense of the word, as if you've suddenly acquired a maturity you didn't have at 17 or younger. Colloquially, it's quite normal to refer to 18, 19, 20-year-olds as kids, college kids, for example. They're having a casual style interview, a conversation. It's not a debate or giving testimony in court where it behoves one to be very precise about everything you say. Jordan Peterson pretty much disregards the legal age thing altogether in his comments. By kids, they are talking about young people with their lives ahead of them, and Stephen's pedantry on whether this or that happens below the age of consent misses the point, in my opinion. Right, early in the video, Stephen expresses his purpose. He says,
I sincerely believe that Elon, and especially Jordan, are making some very serious mistakes, and hopefully I'm going to be able to articulate these concerns sufficiently.
I, in turn, sincerely believe that Stephen is making serious and inexcusable mistakes, which I will show you. Let's get to it, starting at the very beginning of Stephen's video.
So my son Xavier is dead, killed by the woke mind virus.
Oh, so COVID's no big deal, but the woke mind virus ends lives.
He says with a contemptuous smirk. In the very first few seconds, in my opinion, he renders the title of his video, his accusation of Elon Musk lacking empathy, somewhat ironic. For those whose capacity for human empathy remains intact, is it possible that Elon could be speaking from a place of deep pain? This is his oldest surviving child that he's talking about here. I know he's sired a ridiculous number of children since, but this son is one of the twins, the older twin, that his first wife had after the sad loss of their first baby to a cot death. A son that he might once have had a close relationship with and whom he cherished as a son. Xavier no longer wishes to be Elon's son or anyone else's son. He wishes he were a girl, and Elon feels it as a bereavement. Is that really so hard to understand? I didn't know any of the details of this kid and his transition, but Stephen tells us that Elon had mentioned publicly a few times that Xavier had, quotes, exhibited strong gender dysphoria from an early age, and on reaching the age of 18 a couple of years ago, he changed his name to Vivian and publicly disowned his father. We then see this.
They give them sterilizing drugs, which are called also a misnomer, puberty blocker. These are sterilization drugs, so they can never have children again.
Yeah.
They can have double mastectomies, the mutilation.
They have their forearms stripped to build non-functioning penises.
Yeah.
Right. Stephen is now going to tell us what he thinks is wrong with what has just been said, but before he does, I'll say what I think is wrong with it. Really, there's just one thing, and that is that Elon describes it as a misnomer to call gonadotropin-releasing hormone agonists puberty blockers. It isn't. It's one of the things they are used for, in addition to a variety of conditions, including hormone-sensitive cancers. They literally stop puberty. Remember puberty, that stage of life when our bodies go through all those embarrassing changes and we become capable of reproducing. We suddenly grow taller, our bone density increases, and crucial developments in brain structure and functioning take place. Puberty blockers stop all of these happening. They are licensed to block what is called precocious puberty, meaning puberty that starts atypically early. They can be used to delay puberty until the child is a bit older. They can then be stopped, allowing the child to go through puberty at the same age as his or her peers. There is mounting evidence that there are long-term detrimental effects, even if they are only used for a couple of years for that purpose. I've covered all this stuff in previous videos. For many years now, they have also been used off license to stop puberty in perfectly healthy children who present as experiencing distress about their sex. Elon has homed in on the one effect of stopping fertility, but there are others. Let's hear from Stephen.
This statement from Elon is, simply put, inaccurate. While puberty blockers do impact fertility during use, their effects are generally not permanent.
I'm going to nitpick here. Stephen says effects, plural, although he seems to be only talking about their effect on fertility and not on any of the other effects, evidence for which has been increasing in recent years. One of the main things that came out of the Cass review is the lack of evidence of long-term safety for puberty blockers and the numerous side effects. Children presenting with so-called gender dysphoria who are put on puberty blockers are guinea pigs. Now, in his eagerness to defend puberty blockers from the charge of being sterilization drugs, Stephen does this really bizarre thing. He names 3 other drugs and uses them as analogies for puberty blockers. The first example is anabolic steroids for bodybuilders. Listen.
To put this into perspective, consider bodybuilders who use steroids. You might know someone who's given themselves a bit of an edge, let's face it, a very large edge, with exogenous testosterone. This external testosterone causes their bodies to reduce natural testosterone production, leading to a temporary shrinkage of the testicles and reduced fertility. However, once they stop using steroids, most of them regain their natural testosterone levels and fertility over time.
Right, how are anabolic steroids that use synthetic testosterone to build muscles and are used by adults, how are they in any way comparable to drugs used to block testosterone to prevent the changes these cause to the body in children? They kind of almost seem like opposites. Puberty blockers don't shrink fully developed testicles. They stop them fully developing in the first place. See the difference? I'll skip the second example he gives for the moment. The third example is the contraceptive pill, which you can take for years to prevent pregnancy. You stop it and you get pregnant, as long as you can get a sperm from somewhere, and just stopping the pill won't do, obviously. Again, these are prescribed to sexually mature females, even though that includes some very young girls. And again, they release estrogen and progestogen to prevent ovulation. How are they comparable to drugs that block estrogen? And in between those two examples, which at least have something to do with hormones, we get this.
Similarly, patients undergoing chemotherapy often experience temporary infertility, but many regain their fertility after treatment ends.
Is he seriously arguing that because some completely different drugs lower fertility in men and prevent pregnancy in women while you're on them, and these effects aren't permanent, then the same must be true of puberty blockers? Where's the rationality in that, Mr. Rationality Rules? Using drugs that do something completely different as analogies for puberty blockers is total rubbish and should be disregarded. Next.
The use of puberty blockers is intended to be a temporary measure, and most individuals can regain their fertility if the treatment is discontinued appropriately. Now, of course, this is that most regain their fertility, but unfortunately, as is the case with all drugs, there are exceptions where the side effects can be long-term. But to paint this as either the standard or even the intentional outcome is grossly misrepresentative.
I don't think anyone's presenting infertility as the intentional outcome. And yes, okay, the truth, as far as we know at present, is that if puberty blockers are taken at the start of puberty for a limited period, then stopped, normal puberty will eventually begin, provided there is nothing to prevent that happening. According to the best evidence available, some 98% of kids who are put on puberty blockers go on to cross-sex hormones. There is no evidence that puberty blockers relieve the distress these young people feel about their sex, so-called gender dysphoria, and they're not supposed to. Why would they? They keep young people in a state of frozen childhood. The justification for them is that they give the young person time to consider whether they want to pursue the idea of changing their physical appearance so they look more like the other sex. If nothing has happened to make these young people feel better about themselves, why wouldn't they go down that path? Especially as we now know from many accounts by detransitioners that they were not warned about all the other negative effects. If a child starts on puberty blockers early enough and goes straight onto cross-sex hormones, then they are more likely than not to be infertile. So, yes, Elon Musk is being a bit hyperbolic when he calls them sterilization drugs, which might give the impression that just taking puberty blockers will impair fertility, when to be strictly accurate, it is puberty blockers started early and followed by cross-sex hormones that destroys fertility in people who are far too young to make a decision about whether they will ever want to reproduce. So no, I don't agree that it is grossly misrepresentative to call them sterilizing drugs. It's just a bit hyperbolic. What I would call gross and misrepresentative is Stephen's omission of the other negative effects: loss of sexual function, osteoporosis causing broken bones and even permanent disability in teenagers, and the negative impact on brain development, all of which were covered in the CAS review.
They can have double mastectomies.
Double mastectomies for children, that is top surgery or chest masculation surgery, is not typically performed on children. It's actually extremely rare, and when it occurs, it's always with parental consent and after thorough psychological evaluation. Now, I haven't personally given this one enough thought.
No, you haven't, and you haven't done the research either. You are pontificating on a subject about which you know nothing. You appear to be unfamiliar with the very word mastectomy. You don't even pronounce it right. A couple of years ago, in response to similar pronouncements by the idiot Rebecca Watson, I devoted a video to teen surgeries as part of gender-affirming care. Here's a clip. All these are physically healthy girls and young women who had double mastectomies because they wanted to be boys. As you can see, 2 were 13 years old, 5 were 14, 9 were 15, nearly half of them were under 18, and if we include the 18 and 19-year-olds, that's 80% who were still in their teens. And it gets worse, actually. Gender therapist Kellyn Lackard of the Kaiser Permanente healthcare organization in California admits that her colleagues have removed tissue from the healthy growing breast of a confused 12-year-old girl.
In terms of masculinizing top surgery, I think 12 is the youngest who's had surgery through our program.
The chart that I showed in that video comes from this paper by the evil Johanna Olsen Kennedy. It was published in 2018. I wanted to see if anything more recent had been published, and it took all of 10 seconds to find this paper by Annie Tang, published in 2022 on gender-affirming mastectomies carried out in the US between 2013 and 2020. It says, the incidence of gender-affirming mastectomy increased 13-fold during the study period. Of the 209 patients who underwent surgery, the median age at referral was 16 years, range 12 to 17. This is really alarming, and it should give rise to very serious concerns about what the hell is causing these young girls to want to escape their female bodies, because it's not that they are really boys who were born in the wrong body. And why does a parent consenting to their daughter having her healthy breasts amputated make it okay somehow, as Stephen clearly implies? It's not their body or their life that's going to be impacted long term, and even if in the long term the girl is happy with that decision, it's not necessary to do this while she's still in her teens or even pre-teen. Jeez. What was the other claim? Oh, it only happens after thorough psychological evaluation. Oh, does it? How do you know? Where is your citation? This guy gives no references for anything he says. He doesn't even provide references for the papers he shows, which we'll look at in a minute. I could not find any evidence of these girls having had thorough psychological evaluations, but even if he could show us that some of them have had that, it would still be wrong to say it only happens in those circumstances, because we know from the accounts given by regretful detransitioners that it doesn't. Here are a few examples.
I came out as transgender in a letter I sent on the dining room table. My parents were immediately concerned. They felt like they needed to get outside help from medical professionals, but this proved to be a mistake. It immediately set our entire family down a path of ideologically motivated deceit and coercion. The gender specialist I was taken to see told my parents that I needed to be put on puberty-blocking drugs right away. They asked my parents a simple question: would you rather have a dead daughter or a living transgender son? The choice was enough for my parents to let their guard down, and in retrospect, I can't blame them. This was the moment that we all became victims of so-called gender-affirming care. I was fast-tracked onto puberty blockers and then testosterone. I had a double mastectomy at 15.
I went online and I found someone who called themselves a transgender expert. But when I went in for my first time appointment, she immediately gave me my letter of recommendation for both hormones and surgery, which I took to the first endocrinologist and surgeon that I could find, and they accepted the letters and gave me what I wanted.
I began transitioning at 12 years old. 12 years old when I started Lupron and testosterone, and it was only a month after my 13th birthday that I had a double mastectomy. I am actively suing Kaiser Permanente, and I'm suing the doctors that gave me those treatments. I really feel like they just purely only affirmed, and they didn't like dig deeper into the why of it. It's just that, okay, you feel like you're a boy, let's affirm that. Let's set you on that route. Let's make you comfortable in that, instead of trying to assess the underlying issues and maybe make myself comfortable with my body without such radical measures.
There are others I could show, but I'm not going to, because I find this whole issue quite distressing enough, especially with the likes of Stephen casually promoting falsehoods about it. I shouldn't have to labour the point and show every heartbreaking story I come across. If those weren't enough to penetrate someone's thick skull, nothing will. Next.
Their forearms stripped to build non-functioning penises.
But this claim from Jordan, man, it's wild. Citation needed. Seriously, citation needed.
Oh, the irony of the man who provides no citations demanding a citation. But citation for what? He surely knows that phalloplasties are indeed created using flesh from the forearm nowadays. A big radial forearm flap is removed, leaving the forearm looking... I can't even bear to think about the pictures I've seen, never mind show you one.
Genital reconstruction surgeries, including phalloplasty, that is the creation of a penis, are not performed on children.
Oh yeah, it's the age thing, of course. He is misinterpreting Jordan as claiming that these grotesque procedures are carried out on girls below the age of independence, rather than just on girls who are still kids in the colloquial sense of being teenagers and young adults. Let it go.
More than anything that Elon has said so far, the language that Jordan is using is fear-mongering. Would he, for instance, call reconstruction after a serious burn stripping someone's limb because some of the skin from an arm or leg is used to replace the burnt tissue? I don't think so.
Why not, if that's what happens? Although it isn't usually what happens. It's usually a partial or full thickness skin grafts that are used for burns rather than big flaps attached to a blood supply. But how pathetic to object to a word that actually conjures up a very accurate image of what happens. Would it be fear-mongering to show photos of what it looks like? Because nothing prepares you for seeing one if you haven't done before. Now we're going to move on to suicide. In the next bit, Elon Musk says he was tricked into signing consent forms for his son to get the so-called gender-affirming treatment his son wanted.
I was told, Xavier might commit suicide if he...
That was a lie right from the outset. No reliable clinician ever believed that. There was never any evidence for that.
This is a story that many, many parents are telling, and so far I haven't seen any of those being accused of using this particularly egregious form of emotional blackmail coming out and publicly denying it. Here, Stephen?
But Jordan? Oh, what the hell, Jordan?
Oh, get an acting coach.
There is evidence for this. As I expressed in my last response to Jordan, a 2020 study published by Pediatrics found that transgender youth who receive puberty blockers had lower odds of lifetime suicide attempts and ideation compared to those who wanted but did not receive the blockers.
Notice how he doesn't even name the paper or who wrote it. He just shows text with one sentence highlighted, leaving viewers to find it ourselves. This is the paper which used a cross-sectional survey of trans-identifying adults to look at self-reported history of pubertal suppression during adolescence. I've talked about it before. In the video I did about Rebecca Watson and Sabina Hossenfelder. In the same video, I talked about the lead author of that paper, farmer shill Jack L. Turban, who gets paid by manufacturers of triptorelin. If we scroll down, we see a few fawning comments and some very substantive criticisms from, amongst others, Dr. Paul Cruz, an endocrinologist of Washington University Medical School, and our very own expert, Professor Michael Biggs of Oxford University, both of whom I'm inclined to trust more than someone paid to promote puberty blockers. It beggars belief that Stephen thinks that just showing one sentence of this paper goes any way towards debunking Jordan's claim, which, remember, is that there is no evidence that young people will commit suicide if denied gender affirmation. Stephen apparently doesn't even understand the sentence he highlighted. Let's look at it. There is a significant inverse association between treatment with pubertal suppression during adolescence and lifetime suicidal ideation among transgender adults who ever wanted this treatment. Spot the difference. Suicide ideation, also called suicidality, refers to mainly suicidal thoughts which are self-reported. Actual suicide amongst young people is extremely rare. I don't believe that Stephen even read this whole paper. If he had, he would have read this sentence pointing out that, given this study's retrospective self-report survey design, we were unable to capture information regarding completed suicides. And if he did read that before asserting that it refutes Jordan's claim when it obviously doesn't, then he's either a bit thick or he's deliberately trying to pull the wool over his viewers' eyes. Not a good look either way. Other criticisms of that paper made in the discussion below it include that the authors, by their own admission, state that their data cannot establish a causal relationship between blocking puberty and suicidality. And they fail to emphasize that, quotes, those who received puberty blockade and those that did not both had alarmingly high rates of suicidal ideation, and that those receiving puberty blockers had higher rates of hospitalization for suicide attempts when compared to those who hadn't been on them. That was part of a long detailed letter by Dr. Paul Kruse. You may be able to see that he starts the letter saying, this paper is widely interpreted as providing evidence that GnRH agonists are beneficial in preventing suicide in transgender youth, but that the paper does not warrant that conclusion. There is a mountain of evidence that those who claim a transgender identity have pre-existing mental health problems, which, as I argued in another very recent video I called The Invention of Gender Dysphoria, is why so many people are looking to transgenderism as an escape route. Dr. Kruse, in his letter, suggests a plausible explanation is that suicidal risk is almost independent of taking puberty blockers because they fail to address important co-occurring psychological issues. And there are other very pertinent criticisms made of this paper, both below it and elsewhere on the web. It's been very competently debunked, as Stephen would know if he'd done his research. But I hope I've said enough to show that this paper does not do what he claims it does. I'll link to it below, of course, along with any other relevant sources I use, though I won't bother with the next one.
Another study, this time from JAMA Surgery,
What's it called?
found that adults with a history of gender-affirming surgery had 42% lower odds of experiencing severe psychological distress in the past month, and 44% lower odds of past-year suicidal ideation.
And again, no name, no title, no link, and I wasted time looking for the damn paper so I could show it to you. Association between gender-affirming surgeries and mental health outcomes, and it uses data from the same online survey used by Turban's team. And the surgeries, by the way, are not just mastectomies and genital surgery. They include things like facial feminization surgery and boob jobs for the men. But I didn't bother reading the paper because it's irrelevant.
Jordan confidently calls this a lie.
No, he doesn't. That's a lie.
But with what? What evidence does he have? How can he say this so confidently?
Oh, come on, Stephen. What Jordan is calling a lie is the suggestion from clinicians that a parent is in danger of losing their child to suicide if they don't consent to them getting either hormone blockers or cross-sex hormones. You showed it to us, Stephen. We all saw it. Jordan said nothing about trans-identifying adults who freely chose their own surgeries and are feeling better for it, which is the subject of this paper you have dug up and inexplicably claimed that it is evidence that refutes what Jordan says. What are you doing? The reason Jordan is confidently calling out a lie is because it is. There is indeed no evidence to support the idea that a child will commit suicide if denied affirmation. You certainly haven't shown us any. You know, this guy created a card game about logical fallacies, and I was thinking of buying it. What's the fallacy he's doing now? Sleight of hand or something? No, I think a sleight of hand is probably a bit cleverer than saying something completely false about something he's shown us himself and then acting all bewildered and frustrated as if he doesn't know it. Or maybe he doesn't know it. Maybe he really is this stupid. There's about another 5 minutes to this video in which he carries on in the same vein, conflating suicide with suicide ideation while not actually talking about the suicide rate at all. I mean, has it gone down since gender-affirming treatments became widely available 15 or 20 years ago? No. Doesn't that make you think? Also no, apparently. He claims we have good evidence for things that we don't, and he generally defends the indefensible. But I'm done. I can't be bothered anymore with someone who is obviously so enthralled to this very regressive notion that people are the wrong sex and they should be able to LARP as the other one, that he will suspend whatever critical faculties he may have. He will ignore the findings of the CAS review in order to produce videos that defend the use of interventions on children and young people of proven harm in order to keep in with the cult. There's no such thing as a trans child, and transing children is child abuse. Shameful. That's all.